Okay, I'm going to run through this article here quickly from the New York Times. Scroll through so you can read. We are in disaster mode. Courage inside a Brooklyn hospital confronting coronavirus. See, this is what's going on here. This is the hospital closest to me where I've been to when I was a patient. It's really heroic. This is Dr. Sylvie D'Souza, Chair of Emergency Medicine at Brooklyn Hospital Center. She been working like weeks without any day off. Hmm. Hospital, 175-year-old hospital where Walt Whitman brought peaches and poems to comfort the Civil War wounded, and where Anthony Fauci, the White House advisor who is now America's most famous doctor, was born, is scaling up, as Governor Andrew Cuomo has required all New York hospitals to do. The city, now the epicenter of the outbreak in the United States, had reported more than 20,000 confirmed infections and 280 deaths of late Wednesday. So you can go through this, you can stop it and read. This doctor right here, 31 years old, he came down with it. I know somebody the other day in one of the videos, one of the vloggers said he's 31 years old, and chances are he's not gonna come down with it. Well, look at this doctor. Hmm? 31 years old, and he became a patient in the same hospital where he worked. This is the entrance to the hospital. These two people wearing masks. Hmm. So, at the very end of the article, Dr. D'Souza says they just take their courage in their hands. She's talking about her team, the staff who work for her. Dr. D'Souza said of her team, they put on their garb and they show up. That's what they do. Of course they have anxiety. Of course they have fear. They're human. None of us know where this is taking us. We don't even know if we might get sick. But none of them so far has defaulted on their duty, their calling. Sounds kind of poetic, isn't it? Let's see. And the comments There's some pics from the New York Times here. I'm just gonna scroll through. Anybody wants to read these? The pics and all the comments. This person said, I'm still surprised that the nurses and doctors aren't afraid of the virus. It's very brave and courageous to be of them to still be helping people who may be carrying the virus. The one good thing about the virus is that people, including myself, are starting to realize how important and amazing doctors and nurses are. Without them, thousands of people would die or be left uninformed about the virus. And somebody replied from New Mexico, "We are very afraid. I cry every day on the way to work and the way home. I'm in my 30s and I completed my will this week and discussed my end if life care wishes with my husband. The work needs to be done though, whether or not I'm afraid. I knew the worst case scenario of what I was signing on for when I chose my field." I'm scrolling through this for people who like to read. Lots of comments here. You can spend the whole day reading this stuff. There's too many comments. Alright, it just keeps going on and on. So let me stop right there.